a dance class at her school. She did gymnastics. Ava rides her bike, she runs, she does everything a normal kid does.
I wish only rainbows and music in her life, that with everything that she does, and inspiration and creativity.
I just want to empower her. She may have roadblocks in her life, but she can overcome it. Ava has a rare blood disease. There's only 10,000 to maybe 50,000 people in the whole world who have this. Ava's missing a protein in her blood. And without this protein, her body swells. Ava has swollen on her face, her eyes to her lips, her arms and hands weakly, feet and legs, knees, thighs, butt, genitals, stomach, intestines. We've had every area swell but a throat.
It feels like my foot's asleep.
I always tell Ava she has special blood, and so she can tell people if she looks different or is swollen, I have special blood, and sometimes I swell.
Daddy or mommy?
Mommy. Okay, you.
That's right. I didn't know that it would be a problem. I thought it would be something that I had, because it's not contagious, so, there's no risk. But I found out there was. That there's a 50-50 chance that any offspring that I would have, that the gene would mutate in their blood.
Can you tell me?
Yeah.
What does that feel like?
I have to go to the ER.
If you were to slam your fingers in a car door, right, your fingers would swell up. Well, my fingers would swell up too. The only difference is the swelling wouldn't stop. The body doesn't have the mechanism to tell it to stop. So my fingers would swell, my hand, my forearm, all the way up to my shoulders. And that would happen for about 3 days, and they would eventually dissipate like nothing happened.
One time, I swelled both eyes.
Both eyes.
And it's good, I never swelled in my throat. Finally.
There's one particular instance that I can remember that her eyes were swollen. And it was one eye that was swollen, and it was moving over her face to the other eye. And that was tough. That was tough because I knew that she wouldn't be able to see out of both eyes. And it would only last about a day, but it would be a rough day for her not to see at all.
Freshman year, I was at a new studio, dancing my life away, really. I had no limits. I was in the best shape I'd ever been in, and then it all stopped. Are you sleepy? Are you sleepy?
So 2009, she was in the dance studio. She dances a lot, and she started swelling and was having difficulty breathing.
I guess at first, we didn't really have a straightforward, this is what you have, because the blood tests came back and they were normal, but the medicine worked. So I was like, what's really wrong?
Doctor said that she was really concerned, and she didn't want to make the diagnosis for HAE because it was a really big deal.
I remember I was at school, and I was talking to one of my teachers about it, and I was like, I don't know what this is. And I just remember going out in the hallway and crying. That's when I realized, I was like, life is going to be different from here on out.
Hereditary angioedema is a genetic condition. That's where the name hereditary comes from. So it runs in families. And it's a condition where there's a gene that's actually mutated, and because of that, the body doesn't make enough of a certain protein.
HAE is a disease of swelling. It's really the bottom line, but this is the type of swelling when your hand is swollen. It swells to such a degree that you can't move it. When your feet are swollen, it's very difficult to walk.
Their skin will swell up, sometimes their intestines will swell, or in some cases the throat, the airway will actually swell up.
I kind of just feel my stomach just kind of expands, like when you're bloated from eating food. That's kind of what it feels like, and then the pain kicks in, and your stomach gets more swollen.
From attack to attack, the swelling can be fairly mild. It just involves, let's say, a few fingers. It lasts a couple days and goes down, and it goes all the way to attacks that cause a lot of disability and even death.
She had some swelling in her arm. One evening they had to come in and actually cut off her hospital band because her arms were swelling so bad. And so that was more swelling than we had ever seen. I mean, her whole body was impacted.
Well, it starts at your stomach and there's pain and whatever, like, as it goes to your arm. I think those don't hurt as much, but unless it is like severely swollen. But your throat really hurts. That's the worst one to me.
He's very mature, stoic, as many children who have such serious illnesses are. Very bright. He downplays having HAE, and we don't talk about it. We're here to meet his needs when he has an episode, but he just acts as every other child does in the school.
I thought he was very charismatic. He comes in and he just lights up the room. He wants to be friends with everyone. He's extremely kind, and he would give you the shirt off his back.
And I credit that to his parents. I mean, his mother has let us know that he wants to lead and can lead a very normal life.
Me, my mom, my grandmom that have HAE.
It's interesting with us because it's 3 generations. My mom was different. Like, I want to say up until maybe 2 years ago, because she felt it was easier. If her hand was swollen and someone would say, "Oh, did you sprain it?" She would say, "Yeah." You know, and I would get so upset. Why would you do that? She's the oldest, had the disease the longest.
Because once you live through it with your child, then you have to live through it with your grandchild. It gets even scarier, because, like, I should be better at this.
No, it was mocha with a hazelnut cream. There you go. It's pretty good.
My worst attack was when I was 6, and I had meningoencephalitis, Kawasaki, 6 nerve palsy. What was the other one?
Aseptic meningitis.
And aseptic meningitis. I don't remember what happened, but I know it hurt. That's all I remember.
He told me he had a stomach ache, and I said, "Okay, you need to go to the nurse's office." And I didn't realize until later how big a deal it really was that he had gone to the nurse immediately. They actually had an ambulance come and take him that day.
He was like in a stupor, like comatose for 3 days. Noah, as you get to know him, jokes a lot. So Noah's like, "Oh, wow, I really can't see. It's 2 of you, Sean." And I thought nothing of it. And he had a pretty long bout of double vision, so he had to walk around with a patch. But I think because of our personality, he didn't care.
Tell me the story of your worst attack.
When I went to the bathroom, I went to swallow, and I couldn't swallow, and it was kind of like the weirdest feeling in my life. Like I was drowning in my own saliva, and now I can't breathe. I just accepted, this is it. I'm probably gonna die this way. So I slid to the bedroom, and I went to pull on the blanket. Noah's father woke up, and he's like, "Oh my God, what's wrong?" And I was tired of trying to breathe. Like, I just had nothing left in me. As soon as they got me to the hospital, they had to intubate me. So it took 12 days, and then I was in step down for 6 days. And it took like the whole summer for me to get my voice back.
One of my patients, who I had seen for many years and knew quite well, called me and told me that she was beginning to have some swelling in her mouth. And because of the risk of her breathing tube closing, I said she should come into the hospital. Well, as it turned out, she had a plumber coming to do a repair at her house, and it's so hard to get a plumber that she decided to wait until he came. So she waited. It took a few extra hours, and by the time she arrived at the hospital and got to the unit, she was starting to turn blue. We basically put her on a cart and rolled her down to the operating room with a head and neck surgeon accompanying us just immediately. And the surgeon had to open her breathing tube through her neck without anesthesia, because we did not have time to put her under anesthesia. And we came within a hair's breadth of having her die. And it was an experience that I hope I never have to repeat again.
My main purpose in life is hereditary angioedema awareness due to me losing a child to HAE. I have HAE myself. My oldest daughter has it as well. It was pretty much called the more colic around here, the more disease, the more plague.
Nobody knew what it was. And as a result, a lot of people were misdiagnosed. Physicians would just say, I don't know what's wrong with you. A lot of our patients have been referred for psychiatric consultation because nobody really understood what they had.
I really didn't find out about what it was actually called till I was diagnosed when I was 23.
I guess from 7th grade to my freshman year, it was like a 2-year, probably about a 2-year diagnosis period.
Many doctors aren't even aware of HAE, and so I think awareness is not great in many parts of the country.
You know, they're like, okay, we don't know what you have, you know? And so, and a few people would call, they'd make a few calls, and a few other people would come in, and they wouldn't know anything, so they would just kind of drop it. I wasn't like, oh, we got a live one. Oh, we got one that we can study. We got one that that is willing to do these things, and it's great. Let's build a case around this patient. But it wasn't like that. I was kind of hoping it would be. Like, you know what I mean? It's like kind of like in the movies, you know?
Defective DNA is keeping them from making a critical protein, hence the fluid buildup.
Angioedema?
Hereditary angioedema.
It's an incredibly rare disease.
Symptoms fit perfectly.
That wasn't the reality. The reality was that, well, you know, can't help you. I'm sorry. I don't know what else I can do. And so that became very frustrating.
There's a long delay from the time people start swelling to the time that they actually get the right diagnosis and proper treatment. It's, depending on the study, it's somewhere between 10 and 15 years on average.
I had to have my appendix removed also in 7th grade. And then after finding out what I had and the abdominal attacks I had prior, it felt the same. I'm thinking, you know, they took my appendix out for no reason.
Most adult patients with hereditary angioedema have had abdominal surgery that was not necessary. It was an angioedema attack that the surgeon was convinced that they had ruptured an appendix or something of that nature, and that there was a surgical emergency that they had to operate on.
Most physicians in their career will not see an attack of hereditary angioedema. It's a rare disease.
It's knowing what to look for and what testing to send when patients show up with these symptoms. So I'd say we're in the middle of the pack. We have there's definitely room for improvement in the United States.
One specific time I remember, my mom has this huge binder of medical records, doctors,
our business cards and contacts, just some informational things.
She showed doctor the binder at the ER, and she was like, can you step out of the room? And I was like, well, why does she need to leave? And they were like, well, you look 7 months pregnant. And I was like, well, I'm not pregnant. That's impossible. It's rough when you show up with all this information and doctors are like, well, I don't think that's what it is.
Her abdomen was distended to 104 centimeters. I mean, she's horrible little stretch marks for a young lady who has not had to go through all of the things that women go through.
Hello. I'd like to thank the Academy. I'd like to thank Mom and Daddy for accidentally having me. When I met up with Laura Moore last year, well, we'd already talked before that, and I stood next to someone who knew what it's like to be me without me opening my mouth. That's when I really understood, because she's lost a baby girl and I've lost a son, and people don't understand, and they say they do, or they mean well and they give their condolences, and I accept those graciously. I appreciate it. But for whatever reason, she knows me before I ever tell her who I am. June of 2008, he came in the kitchen and he said, Mama, I don't feel good. He didn't tell me his throat was hurting. I said, just go get distracted and I'll get you to the hospital in a minute. And he come back later, he said, I don't think I can wait. Goes to the hospital. They decide to treat him for asthma, knowing that they've treated him for 10 years with HAE. Anyway, he gets mad. He gets up to leave. He hits the foyer. His throat closes up. I mean, it happens so fast.
A throat attack, it starts out, you're guessing. You're thinking maybe it's a sore throat. And then it gets tighter. It hurts to eat. It hurts to swallow. A lot of times your voice will change. It's very confusing at first, and then it really becomes worrisome, which makes the attack worse. You know, stress and worry is a big trigger for me. And you feel very helpless. Lyndon, she was a blessing. She started swelling when she was 4 years old, but usually it went right for her throat. We was always in the emergency room. September 28th, 2004, when she was 12. She started swelling at school and didn't tell me. And I picked her up after she got off the bus. And she said, Mom, I had a throat attack earlier. And I'm like, are you still swelling? She goes, no, I think it's getting better. And I'm like, are you sure? Because we'll go to the emergency room and make sure. Because usually when she would panic. She'd say, I'm swelling, let's go to the emergency room, which we would. And she insisted, I'm getting better. I'm like, okay. So we went home, and me and her and Hillary was sitting in the living room. We watched TV, typical Tuesday night. About 10 o'clock, she said, Mom, I think I can sleep. I'm better. Don't worry about me. Everything's fine. I tucked her in, told her come get me if she needed me. I loved her, I went back in the living room, which was right beside her bedroom, and sat there for about 10 minutes. And she come in, gasping for air, and collapsed and died in my arms.
I remember just walking out the front door and just walking and screaming. And then the lady that had come first, the rapid responder, she's the one that told me that Lyndon had died. And I couldn't take it. I couldn't believe it. Was angry. I was very angry. And then I remember, my mom just held my sister for, I don't even know how long. It could have been hours before she would let him take her. And I knew, right then, I'm like, our lives will never, ever be the same.
I went ahead and started walking down to the gym, and I heard two other kids from my class talking, and they said, Samantha, you're a friend of Lyndon's. It's true, isn't it? I said, what's true? They said, Lyndon died last night. I said, you guys are crazy. And they were like, no, we're serious. So I dropped my bag there and ran to the gym. When I came into the gym, everyone was just in tears. And, the coaches were there, the counselors were there, and I knew then that it was true.
I used to dance all the time, and it's still one of my favorite things to do, but it's kind of hard.
We would take her to dance, but then she wouldn't be able to, complete the entire class, so she would have to leave and come home. When she was swelling so frequently, it was hard for her to go to class because she didn't feel good. And it's hard to be on a team when you can't be there for your team 100% of the time.
Dancing is like my freedom. Walking into the studio or even to practice at school, I can forget about life really and just be the old Kelsie or, you know, who I want to be. Hi, guys. Hey. The Huggables are 7 girls that have Down syndrome that want to dance. So we teach dance class every Sunday for about an hour. Sometimes we do performances and compete. It started off, it was a little weird because we'd never really taught a class before. Now we were teaching 6 girls that have Down syndrome, you know, how to dance. And it started off rough, but we got used to it. And those girls are like my little sisters. Like, I would do anything for them. And it's really great. And it's great. I mean, I wouldn't have it any other way, to be honest. If I'm gonna have this, I might as well get something out of it, so.
What's the worst thing that's happened because of HAE?
Probably dance. Sorry, this is like it was rough. It was my life for so long. And I don't have it anymore. But there's nothing I can do about it, so. Sorry.
I play soccer, baseball, basketball, and football. I'm not like one of those little chicken people. I'll actually go against a 14-year-old or something like that. The thing that's really bad about it, every time I fall and playing basketball or something, which is rarely, I'm very good at basketball. Like, I might scrape my knee, and they'll be like, "Oh, are you okay? Is it an HAE attack? Is your knee swollen?" That's the messed up part about it. When I first discovered it, I was 6 years old. Then I got like that meningeal encephalitis stuff in that, so I stopped, and then I had the concussion, so I couldn't play. I definitely want to play football. That is the one and only thing I'm aiming for this summer, is to play football.
This one here, unbelievable. He just bounces around like it's nothing.
Noah can literally go from 0 to 100 in a matter of an hour time span. So for that, we're grateful.
I'd rather other people have a cure than me, because I'm like a little okay with this disease. I'm fine.
She has a very interesting outlook on life in the sense that she is perfectly happy playing by herself and or in a group with kids. It's very unique. She loves being creative. So she loves art and she loves music.
She'll tell everyone she has special blood. I've made it for Ava that I don't want her to be embarrassed of this disease. I wanted to empower her and let her know she may be different, but she is a strong little girl and she can work through it and she can accomplish anything she wants.
She has that drive that doesn't need to be attached to someone. She's perfectly happy, and we didn't teach her that. You know, I mean, I thought she would be a needy little child. She has HAE. As her personality developed, you know, and she became 2, 3, 4, when those ages when she starts to really understand the world a little bit, you would think that she would be more needy, but no, she's a very powerful little girl from that perspective, even with a condition like this.
I think she's one of the youngest patients that we've successfully treated for some of these attacks, and she's just doing great. So to me, the most reassuring and really the satisfying thing is her quality of life. Because this is a rare condition, somewhere in the order of 1 in 30,000 to 1 in 50,000 people, it's one of the last things you're gonna think about. And oftentimes it's something that you just heard about in medical school, glossed over, and frankly, for anyone who trained in this over 5 years ago, there was no treatment. But now, I think all the medical students are learning about it and are excited to have something to give. And so the knowledge and the awareness has increased.
Prior to 2009, I used to miss a lot of work. Like, I was out on disability every year. I never knew what it was to be a full-time nurse.
Like, when I was 6, every time I got sick, they couldn't do it because, like, we didn't have the medicine. We had to keep on going to the hospital. Yeah.
We didn't get our first therapy delivered to patients until early in 2009. It was very difficult to get clinical trials.
Obviously, if you have a rare disease, there's not a market for it. If there's not a return on the investment you'd make in a drug, you're not going to invest in a rare disease, because you know at the end of the day, even if you come up with a successful therapy after you spent hundreds of millions, sometimes $1 billion on developing a drug, there's not going to be anyone to buy it, and that's a cruel result for the victim of a rare disease. But that's the effect of the marketplace.
There's 3 types of hereditary angioedema that have been documented. 2 of those are due to protein deficiency. The new frontier in hereditary angioedema is what's historically been called type 3. This is not a protein problem, and yet they swell very similarly to the type 1 and type 2 patients.
You know, at first it was just kind of nice to have a diagnosis that kind of made sense. And then you start researching and realizing, wait a minute, okay, there's type 1 and there's type 2, and she's not fitting the mark on either one of those. So that's when the questions started coming up.
And we have no blood tests right now to accurately diagnose, no extensive treatment trials to show what medications might work best for this group of patients.
We've always kind of thought that hormones were a trigger for her.
We think that estrogen may play an important role in at least triggering or exacerbating the swelling in HAE with normal C1 inhibitor.
Right now we're trying to shut down the ovaries completely so that we can stop the production of estrogen.
When I was in the hospital a couple weeks ago, one of the doctors was like, oh, we'll just take out your ovaries. I was like, I'm 16 now, but in 10, 15, you know, and I might want to have kids. And then there's another thing with, do I ever want to have kids? Because there's a chance that they might have to go through what I went through.
Frankly, it's a lot of trial and error right now, which is frustrating for patients and can be quite costly when you're just trying some things to see if they might help.
I cry in the car, you know. It's been most hard, I think, recently, and I'm gonna try not to get emotional right now, since this last hospitalization, when you have doctors, good doctors, great doctors, calling all over the country and talking to
multiple medical professionals, and then they come in and they look at you and they're like, we don't know how to help.
There's a lot of work that needs to be done in that third type of HAE to help us better understand how to diagnose it and how to treat it.
For a mom, it's heartbreaking, it's heart-wrenching, it angers me, all sorts of emotions. It's almost, I think, sometimes how you feel when you lose a family member or you lose someone close to you. There's like a grieving process that goes, through that, because you're just constantly in flux on the computer all the time. Like, what about this? What about that? And then I start wondering, oh my gosh, am I making this up? Am I creating things in my head? So it's just difficult.
HAE affects everything for my future. It writes my future, really. I mean, if you think about it.
It's hard. She'll have a period of a few months where things go pretty well, and we all kind of get back into that normal swing of things. And then all of a sudden, things change on a dime, and then, she can't go to school on a regular basis, and she'll miss weeks at a time. She can't see her friends, and so at this age, with friends, it's out of sight, out of mind. They're busy, they're teenagers, they live in the moment. And so if Kelsey's not there, she's not in that moment.
I guess my family and friends, I get different reactions from everyone. I've had some friends and family get closer, and I've had some push away. And it's really unfortunate that it has to be that way, but you learn who you can really trust.
And I think it's just mostly hard because people don't understand why we isolate.
People at school know me as, Kelsie with the disease, It's just, not my close friends, but when people see me in the hallway, they're like, oh, how are you feeling? And that was so nice, and it's really great that people care, but that's not something you normally say in the hallway to someone. So to other people, it defines me, but I don't think personally I define myself with HAE.
Going back, I remember when I was about 5 years old, I had swelling in my face, and they thought it was a bee sting. And then all through elementary school, I would get swelling in my stomach, and went to the doctor, and they just said it was a stomach flu. But I'd be, throwing up for hours on end every 20 minutes.
Grandma, Daddy's mom, calls it swelling. And she'd say, well, he's got swelling in his stomach. And I was like, okay. Thinking that it was the flu or, not until, we really were dating and, did I know more about it.
It's funny because when we met, when we tried to meet, my older sister Janet tried to fix us up. And one time she was sick, and then the second time I had HAE, and she came over to the house. We were supposed to meet, but I was stuck in the bed because I had it in my stomach.
And Janet said, well, Chris is kind of feeling under the weather, but, come on up. And I never met him. Well, it turns out he was having an HAE attack. It was in his stomach. And I said, well, can't I just peek my head in to the door and say, hi, I'm Catherine? And no, he didn't want that.
So we didn't even meet, and she knew that I had it.
Finally said, let's just meet for drinks after work. So we went for cocktails. So there was a lot of stress meeting. And then he walked me out to the car and copped a kiss. And I was like, this is not a date. I was really upset with him.
When we first met each other, arguing back and forth.
What does it say? What were you arguing?
We were arguing about anything and everything. She was just very cocky. No pun
You
intended.
were too. You're the rooster.
We hated each other when we first met, so I think that was probably taking priority over explaining any kind of HAE.
I'm trying to get Natalie to get you to.
Okay, so we're done.
Because when you were born, I was like, I wonder if Natalie's going to have HAE.
I remember that one time with you where you were tossing and turning with stomach pains, and I looked at Catherine, I said, she's got it. And it broke my heart.
My name is Natalie Metzger. I'm a film director and producer, and I'm an HAE patient. I don't tell people about it. I don't kind of broadcast it because, you know, it's a fear of like, well, them not trusting me to be able to handle it. And I take on a lot of things. I'm working constantly. And I think that it certainly tarnishes that somewhat if they don't completely understand it or don't, you know, understand how in control of it you can be. An attack for me, if I treat it immediately, will only last probably like 30 minutes to an hour. If I wait, it could take up to a day. And I still sometimes, you know, don't treat immediately if I think I'm just feeling tired. Oh, this isn't, you know, actually an attack, it's just a stomach ache. Then all of a sudden I find myself throwing up in the Piggly Wiggly parking lot and have to treat from there. If it goes without treatment, I'll actually throw up so much that I'll lose so much fluid that I'll go into shock and pass out.
The guilt is just overwhelming that, you know, why did I pass this on?
I think it hurts him more than he's even let on to me or on camera. And yeah, I think it kills him. And especially something like this that's rare, it's potentially fatal, it's something that you have to deal with for all your life. And I think that parents don't want to pass that on to their kids. And from the kids' perspective, you know, like, I mean, I don't blame my dad, I don't blame my grandmother, like there's no blame on our side, but I think it's just, it's heart-wrenching for a parent to know that they've essentially caused their child this kind of pain.
It's a double-edged sword. You don't want to pass it on, but of course having a beautiful daughter and seeing her success warms your heart, but still it breaks your heart that she has what you have.
And gave it, was it our
20th wedding anniversary. For the most part, through medication, I'm able to manage it where I can live pretty much a normal life. But there is always that ball and chain of being near a hospital that always is in the back of my mind.
What are your hopes for your own future?
Just to live my life, you know, watch my kids grow, and just enjoy life. Like I said, I'm here in paradise and can't complain. You know, I really can't complain. I've been blessed with relatively, other than HAE, relatively good health, and wonderful family, and wonderful kids, wonderful wife. Life is good. I pinch myself, you know, I gotta make sure I'm alive.
Ava's diagnosis has changed my life. I'm more on top of her. I'm scared. I have to be honest, there's some nights when I see her swollen, I put her to bed, and I hope that I see her the next morning. You know, when you see your child's eyes rolling back and her gray, pale, so pale she's gray, and her lips have no color, and you're like, I hope I can get to the hospital in time. I hope she lives. I hope this disease doesn't kill her. I hope that she is a strong woman and can know to get treatment when she needs it. It's just hard. It's hard. It's hard seeing her. I remember we were in the hospital and she had such a bad attack, and we came home later and she was fine, and she fought me over taking a Band-Aid off from her IV, and I was like, Ava, after everything we've been through, you won't take off a stinky Band-Aid? And I lost it. I cried, and I started to be so upset. And she's like, Mommy, why are you crying? I'll take off the Band-Aid. And I said, because I almost lost you. And it breaks my heart that this disease can get you so fast. And, it's just hard, When my daughter says, my throat hurts, like, is it a sore throat, or is she gonna swell and stop breathing in the middle of the night? I worry. My daughter's 5, and I have a camera on her, and I hear everything in her room. But at what age do I stop listening? Eventually she's going to be a teenager, and she's not going to want her mommy listening in her room. But I do, and I just worry, But I try to treat her like a normal kid and do normal kid things. But, there's always that chance that, I might not be there, or someone might not see something, and she, who knows what could happen to her.
And there was one story in particular that I'll never forget. Actually, the wife of a patient having a laryngeal attack. He absolutely refused to go to the emergency room. And he said, no matter what I tell them, they treat me for allergies. Then the wife noticed that he had something in his hand, and he put it down on the table. And he said, if I stop breathing, I want you to take that knife and I want you to stick a hole right here. She frantically called 911. And at that moment, he actually began to asphyxiate. He grabbed the knife, poked himself right where he thought his airway was. There was blood everywhere. The paramedics were able to work with the crude tracheotomy that this patient had fashioned for himself, and they saved his life.
Lyndon mainly wanted to be an artist and an author. She loved writing stories.
Very talented in every aspect, drawing, writing, poetry, stories, anything. Very creative personality.
This is her release, She's sat and drew. There's all years. There's the last year she's drew, things she's drew when she was 5. This picture really speaks volumes to me. It's like a anti-bully. It's the popular kids making fun of the smart kids.
Unfortunately, we had mean kids when we were young. And, Lyndon was different from everyone else, so mean kids appeared a lot, but never once did it bring her down at all. I mean, she was one of the strongest kids ever. She could take anything from anyone.
Not long before she passed away, she wrote kind of like an essay at school about how she looked up to me and wanted to be like me, and how much fun it was. That was a big thing, and that's really the hardest thing I have to deal with now, because it's like I would love to have a sister to share all these life experiences with.
This was very out of the ordinary. It was, I don't know if it came back or what, but it's got a mind of its own. It's a very evil disease. Right after the U.S. Senate approved May 16th, HAE Day, Hillary called me and said, let's do something. And I'm like, okay, and I had Lyndon in the back of my mind, want to do something in her honor, but I was going to let Hillary make the call. I was like, well, what do you want to do? And she goes, let's have a walk. And I'm like, okay, what do you want to call it? And she's like, how about Lyndon Brooks Stidham Memorial Walk for HAE? And I'm like, good call.
Not only is it awesome because more people are learning about the disease and there's just more awareness, especially in our community where we really needed it, but it's a way to remember Lyndon every single year, remember our times with her, and keep her memory alive, and I think the walk does that.
Lunchtime, about 12, there's going to be something, I think, going to try to do the talent show and stuff later on after lunch.
That's our angels table. Lyndon, Jim, Jenny's son, Ryan, Claudia Noble's son, Ashley Crow, Jonna Litt's daughter, Rebecca. She also passed away at 12.
Like this is very, very small representation. There's a lot out there.
We know from studying the disease over many years that the historical mortality rate for hereditary angioedema was 30%. So 1 out of 3 people who had HAE died.
Even today, however, occasional patients die, and I think that the figure in the United States is somewhere between a half a dozen to 10 patients a year are still dying because they're either not given the proper medications, they didn't think to use them in time.
At the age of 33, he had an attack during the night and wasn't able to get help in time. He came to us. He lived just across the street from us. And he called me at 5 in the morning. I didn't even recognize his voice. And then I realized, looked at caller ID, realized, and ran out to go to help him. And he'd actually tried to come to our house, and he'd fallen on our porch. And it was very hard for my husband, too. It's hard for me because he called me and said, help me, help me. So how can I ever forget that, actually? He was 33, too young, had children, and it's never right. When someone goes when it shouldn't be their time, or when if you lose a child of any age.
And that's my biggest regret is my baby never had a day that he knew what it felt like to feel good. To not have to worry if your throat's gonna swell up, to not feel pain somewhere. And then the frustration of being a teenager and the frustration of society and the judgments. He screamed at me one day, I'm a monster. And I'm like, no, baby, you're just different.
We have the capability of stopping fatalities today as we speak. The medicines that are available should be able to stop fatalities. So the problem is one of logistics. Can we find the patients, and can we make sure that they get put on proper medications and that their physicians have a good enough management plan that the patient understands that we can basically make sure we're protecting them.
You sure don't want to witness your child die. And as for a child, you don't want to witness your parent die either. I mean, just go to the emergency room, be surrounded by medical professionals, and don't live with the guilt I have to live with.
When you do something in memory of someone who's passed away and it's a cause, that's a healing process to the grief. It gives it meaning and purpose. And I don't believe anybody was born to die in vain. And I've said it before, and I'll say it on camera. We write the lyrics on our children's hearts as parents. Our babies write the music. They're not here to sing it, so we sing it for them.
This disease is not taking anybody else without a fight.
We're now very excited to have two top HAE physicians here in San Diego, in Professor Zuraw and Dr. Riddell.
This center has been designed and established really to serve as a nationwide and hopefully international resource for patients with hereditary angioedema.
This center is going to further HAE research, provide great clinical care, and really set the benchmark for how HAE patients should be treated in the United States.
HAEA, the Hereditary Angioedema Association, is a patient advocacy organization, and we also want to eventually find a cure.
This is a group that has really done nothing but serve the best interests of the patients. They've worked with physicians, academic centers, researchers to really drive forward the advances and try to improve the care that patients have available.
I was 40 before I was diagnosed. After I finally found out what had made me so sick for so many years, all of my life, I actually went on the internet as well and did a search to see, what is this disease? What is this? Now I've been told that I have this hereditary angioedema.
Since it had a name, that means someone else must have had it, and there are other people that have been diagnosed with it. They just couldn't figure out what I was. So when they did figure out what I was, it was a relief knowing that it's out there, it exists, it's real, it's tangible. It's not just a mystery, thing anymore. So that was kind of an amazing experience.
It was that can-do attitude, the fact that people came to conferences, that they did everything that they could individually and collectively to advocate for themselves and for their families. That's why we have therapies that are available today. And that also is why we now have development of next-generation medicines that are going to completely change the lives of HAE patients for the better again.
I actually wrote a letter to my doctors, kind of just saying what we're doing right now is not working, so we need to move on. And I think that helped a lot. I think that's been the biggest thing, is I've started to advocate more for myself and not relying so much on you to do it for me. I've tried to focus on my mental attitude more, just because I'm gonna be off on my own here pretty soon, and it's time to grow up a little bit more.
It felt so great to be around all the people that have what I have. It's like a big family reunion, Everybody just is amazing. I can't express how it makes you feel. I mean, you just don't feel alone.
When you're in a very rare disease like this and you've probably never met anyone else before who has the same disease, it's wonderful to connect like that.
The positive side of it is I've been able, through this condition, to meet some of the most amazing people.
I met another girl who was my age, going to college, and it was just really nice to see that there's other people going through the same thing and they're still living their lives the way they want to. And I was like, oh, I want to do that, so that helped.
You're not alone, and you're connected in some way to other people.
I do believe, given the research that's currently underway, that in the next 5 years we're going to have therapies that are far superior to the treatments that are currently available.
We're very excited about the future. Hopefully we will make a huge difference.
Like I said, it's actually a great time to have HAE. I think there will be a cure. I really believe there will be a cure within the next 10 years.
I'm hoping that advances in medicine can find other treatments for Ava.
Is there anything else that people should know?
I guess stay calm.
You have to put a smile on your face, even if it's not real. You just you have to live your life the way you want to live it, or as best you can.
You do appreciate, I think, life a lot better, and so I think from that standpoint, I think it's made me, I think, a better person.
Go about your life, have a life, be your own advocate, learn as much as you possibly can, and know yourself. This disease is not taking anybody else without a fight.